Good afternoon, and thank you for joining the Duke Initiative for Science and Society for the next installment of our Coronavirus Conversation series. My name is Sarah Rispin-Sedlak, and I'm a Senior Fellow at Science and Society. In a moment, I'll introduce the speakers and moderator for today's event, which will look at the lessons learned from our efforts to conduct contact tracing during the coronavirus pandemic. But first, just a few housekeeping notes. If you have any questions for our panelists, please send them to Timothy McDermott using the Zoom Q&A function at the bottom of your screen. He will redirect those questions to our moderator, who will try to address as many as possible. After the event, I invite you to visit the Science and Society website, scienceandsociety.duke.edu, to learn about the work we do and upcoming events. While you're on the website, you can also learn about our master's degree program, where our students and faculty go in depth on the type of science and technology policy and ethics issues we discuss in these conversations and our other events. Today's conversation is a special one in which Duke students participating in a year-long vast connections project on the privacy implications of COVID-19 contact tracing will report out some of their findings. This interdisciplinary team, which includes undergraduates, graduates, and faculty from multiple schools at Duke, has analyzed contact tracing at the local, state, national, and international level, and looked at how contact tracing technologies have been integrated with person-to-person contact tracing. Team members have assessed the work they've examined against globally accepted fair information privacy principles, considered the long-term impacts of contact tracing, and explored how the approaches have worked with marginalized and persecuted communities. David Hoffman, a professor at the Sanford School of Public Policy and cybersecurity scholar, and one of our 4 faculty leads, will be moderating. With that, I yield the floor to David to begin the conversation.
Sarah, thank you so much. And I also want to thank Professor Farahani and Professor Waitskin with the Science and Society program for making this opportunity available to us. The Bass Connections program and Science and Society are 2 examples of one of the great advantages for being able to teach at and to study at Duke University, which is the ability to be able to do interdisciplinary research and teaching. This particular project is a large and ambitious project, and we've been really able to have tremendous results because of the incredible support and focus from other members of the faculty who have been participating and a large number of students who are on the research team, much greater than the few that you're going to be able to hear from today. I want to specifically call out and thank Professors Rogerson, Dellinger, Shancer, Stansbury, Sullivan, Nayak, and Tantum for all of their work helping to collaborate with each other and to lead and to mentor the students as they've been working on this research. This particular project focused on taking contact tracing and measuring the implications for privacy down to, at the smallest level, Duke University, and looking what a private school like Duke or a private enterprise can do with contact tracing and the impacts on trust with the individual members of that community. Then scaling up from there to look at different sizes of organizations and different approaches to contact tracing, including cities and counties here in North Carolina, then moving up to looking at states' approaches, then moving up and looking at different countries' approaches. From a country's approaches, we've been incredibly fortunate to be able to work with the Organization for Economic Cooperation and Development to participate with them in an effort to examine and compare different approaches that different countries have taken. Throughout all of that, we've had a focus on what is the technology that's at play here, what are the implications of the technology, what could be changed in the technology to increase trust, and what are the implications for at-risk groups, and are they willing to participate in contact tracing efforts to control the spread of the coronavirus? And if not, what could be done to increase their participation? We think that the results of this research are going to be absolutely critical for moving forward. As we move forward with vaccine rollout, it's going to put even a higher priority on contact tracing within individual communities and provide us a better understanding and opportunity to use contact tracing to identify those groups where the vaccine may not be successful and where we may have isolated outbreaks. So with that being said, I would like to introduce the students who are going to present from each of the sub-teams that we've had within the individual project. I'm going to ask them to introduce themselves as they present. And first, I'd like to start with Emily.
Hi, thank you, Professor Hoffman. Hi, everyone. My name is Emily, and I am a sophomore economics major here at Duke with minors in chemistry and biology. I am also a member of the Duke sub-team on this Mass Connections, and I'm just going to give a presentation on our findings so far in the course of our research. So at the beginning of the fall semester last year, the Duke sub-team set out to delve into the details of the data management practices outlined in the Duke Compact to reveal any potential privacy concerns. And the Duke Compact is a signed agreement that requires signees to comply with specific practices designed to keep the community safe and healthy amidst the COVID-19 pandemic. Every student, faculty, and staff member at the university was required to agree to the compact before the start of the fall semester in August, and again before the start of the spring semester in January. Specific practices include wearing a mask and 6-foot physical distancing. Additionally, by signing the Duke Compact, students consent to the university gathering data from their Duke card to access building and parking facilities, as well as financial transactions, Wi-Fi data, which can pinpoint student location based on their access point, campus housing details, and class rosters. Duke states that the data is used primarily for symptom monitoring, compact compliance, contact tracing, modeling for surveillance testing, and reporting aggregate trends such as positivity rate and isolation numbers. So our main focus so far on the Duke sub-team has been to figure out exactly what data is being collected, who has access to it, and where to store it. And a major theme that we've uncovered so far is that as with any form of contact tracing, there is somewhat of a bargain of exchange of personal information. Duke students and faculty are required to let Duke have access to certain information that may be considered sensitive for the sake of the health and safety of the Duke community as a whole. And going into the details of the data management practices, we were informed that Duke collects Wi-Fi and collected Wi-Fi and card access data long before the pandemic began. This information is just being used differently to identify specific locations that someone with a positive COVID test has been to. This data is stored at Duke OIT, the Office of Information Technology, behind a load backer and is secured with encryption and limited access. We were also informed that the contact tracers at Duke only use this information as supplementary information, with the primary source of location information coming from interviews that they conduct with people with positive COVID tests, in which they recount where they have been recently. And while these measures appear to be effective in the fall semester, in which the number of COVID cases for students was kept to only 152, the cases have skyrocketed thus far in the spring, with 657 cases and counting. This increase in cases has come with increased contact tracing efforts, as well as a week-long campus-wide lockdown last month. So our next steps with the Duke sub-team is to investigate the students' perceptions of these contact tracing policies with a survey, which is currently being fielded. And that's all I have, and thank you so much.
Great, Emily, thank you so much. And I think we're all looking forward to getting the results of that survey and understanding, particularly after we saw the increases in those numbers of infections on campus. After the quarantine period, we've seen those rates of infections go down substantially, and to be able to get an understanding of the contact tracing efforts that were done in conjunction with that isolation period. What were the students' perspectives on how that data was collected and how that data was used? So that's going to provide us a really good opportunity to understand within our own confined environment of the university how that works. Then we'll be able to use that for the analysis that the next group has been doing, which is looking at a county level analysis of contact tracing data. And for that, I'd like to ask Annabelle to describe what we've been doing.
Hi everyone, I'm Annabelle and I'm a junior at Duke studying political science with minors in computer science and Chinese. I've been on the cities and county sub-team since the beginning of last semester, and I'm really looking forward to sharing some of the work we've been doing with you all today. So the cities and county sub-team has spent a lot of time collecting data about the COVID-19 resources in general for every one of the 100 counties in North Carolina. And more recently, we have been collecting data about the contact tracing practices specifically when applicable. So our methodology can be summarized by 5 main steps. So we started way back at the beginning of last semester by performing a literature review on contact tracing policies. And that was on various levels and for various locations. So at that point, we weren't so focused on just counties in North Carolina, but we wanted to get a better understanding and as full understanding as we could about the types of policies that exist for something that is pretty new and quite quickly evolving. So then we compiled data from all 100 North Carolina counties regarding the resources related to COVID-19 and contact tracing specifically. At the moment, we are reviewing this data and corresponding literature, and we are also developing a rubric to survey the best contact tracing practices available in the state. We are also writing blog posts about this work as we go along. We've posted our first one and we are hoping to produce our next one in the coming weeks, which is exciting. We are also in the process of reaching out to contacts in county health departments to schedule interviews about contact tracing practices in an effort to obtain some more qualitative data that is not necessarily available on the county websites. We will ultimately aim to compile this information in an effort to publish recommendations. So a focus of our work so far, aside from contact tracing specifically, has been COVID dashboards, which are essentially summaries of statistics like number of cases, number of deaths, number of recovered cases, and so on. And on average, we found that counties that developed their own COVID-19 dashboards had larger populations than those that did not. The average population of all counties studied was 106,543. The average population of counties that developed their own COVID-19 dashboards, so not the same as the statewide version, was 109,410. And there was quite a range within that, with the smallest being just over 11,000 and the largest being about 1.1 million. And then on the other hand, we saw the average population of counties with no COVID dashboard at all was a lot smaller at just over 60,000. And that ranged from just, again, over 11,000 to 372,000. So still some kind of range, but we do see a discrepancy in population size and kind of in-house COVID dashboards. And then moving on to contact tracing. So the average population of the 38 counties in total, which had some kind of reference to contact tracing on their main website or health department website, was 78,953. And this ranged from just over 11,000 to 261,000. So there was considerable variation among population size and contact tracing policies. So the references to contact tracing were generally quite brief and they vary slightly in context, but most commonly these references took place in the context of the procedure in the event someone tests positive, in the context of a health department in general, their overall response to the pandemic. So for instance, in the form of a public health announcement on the website, or in the context of reporting case and testing numbers. So explaining how that data was obtained. And here quickly are some percentages to summarize that work. So 25% of counties do not have a COVID dashboard. 44% of counties built their own specific dashboards. and 32% of counties update their dashboard on a daily basis. 34% of counties connected their residents to local resources as well as statewide resources. And these statistics are important because the data tells a story. A high functioning and frequently updated dashboard means knowledge about local COVID rates, as well as guidance towards public services and support is available. So North Carolina, with a population of 10.5 million, has about 8,751 cases per 100,000 people as of March 31st. This puts the state at around 35 out of the 50 states for coronavirus cases currently. As well as continuing to manage current caseloads, cities and counties have the additional responsibility of vaccine distribution. As we have encountered during this pandemic, many civil services are left up to the discretion of local governments. In order to prepare for the recurrence of a viral pandemic, cities and counties should strengthen their public health infrastructure preemptively. We hope that our findings can help improve North Carolina's public health and privacy one county at a time.
Annabelle, thank you so much. I think the high variation that we've seen from county to county indicates to us that there's substantial opportunity at a state level and then probably throughout the country to be able to provide more guidance, to get information to people. And I think the research that you and the rest of the team with guidance from Professor Rogerson has been critical to be able to show that. Thank you so much. And now I think what we want to do is dial back to a broader look and then to ask our international team to report out. And Luke, are you ready to report?
Yes, I am. Hi, everyone. So my name is Luke Schwartz, and I am a sophomore at Duke studying political science. So the international team's work over the past academic year has culminated into a project where we have partnered with the Organization for Economic Cooperation and Development, or more commonly known as the OECD. We are posing the question as a research team, how have countries approached COVID-19 contact tracing and other COVID-19 response efforts that involve the collection of personal data? As a research team, we are kind of wanting to know what lessons can be learned from these various approaches for, God forbid, any future pandemics. And our report zeroes in on the contact tracing efforts of Australia, the United States, South Korea, Israel, the UK, and Mexico. For example, in the UK, they have developed the NHS Track and Trace contact tracing app, which has drastically decreased the cases that could have been caused by the B117 COVID-19 variant, which was very common in the UK. In the last 3 months of 2020, roughly 2 million people in the UK were infected with COVID-19. And without the intervention from the Track and Trace contact tracing app, Oxford researchers predict that there would have been around 600,000 more COVID-19 cases. And they suggest that for each 1% increase in users of the contact tracing app, that the cases will drop by an average of 0.8% to 2.3%. And obviously, when you're looking at a global pandemic and loss of life, this is a huge difference and really shows the power of effective contact tracing efforts. One thing that facilitated the creation of the app in the first place was specific legislation by the UK to give the government the necessary power to fully address the pandemic. Through our research, we found that this was a trend that was common across the board, with different governments kind of enacting emergency laws to fully address the pandemic. We found that some might have been more symbolic than others, but nonetheless, they've been very important for governments to address the pandemic. And furthermore, it's extremely difficult for governments to impose COVID-19 rules. And this is something that the government's doing through the app, the contact tracing apps in various countries. And without both intense contact tracing and enforcement mechanisms, it's really hard to enforce these rules. One example can be found in New Zealand, where they're using the contact tracing app as kind of a guide to address fines to people for breaking COVID-19 rules. However, it's very hard to police these different rule infractions without very privacy invasive technology built into the contact tracing apps in the first place. And through our research, we have concluded that efficacy and privacy in contact tracing apps are inversely related. The technology simply does not exist yet to prioritize both at the same time, which would obviously lead to the most successful contact tracing app for both the government kind of trying to contain the pandemic and the people who are concerned with their privacy. And last semester, we continued some research started over the summer to offer efficacy and privacy scores to countries' contact tracing efforts based on a series of yes or no questions, and we analyzed the results. On one extreme, there was China with very privacy invasive contact tracing efforts. These efforts have been very effective, but people have little to no privacy when using these contact tracing apps. And then there's the other extreme, which is the United States, that has imposed no federal contact tracing app in the first place. And we think that as a result, this is one of the reasons why the US has been one of the worst countries for the pandemic. But even looking beyond digital contact tracing and giving punishments to those who fail to comply with their rules, there must be strong government leadership to address the pandemic, and the government must lead by example. The US lacked this strong leadership when the pandemic began, and a lot of people kind of cited freedom as an excuse for not wanting to follow a lot of the rules. This mentality and failing to take the pandemic seriously led to immense amounts of lost life. And one way we saw this was through the politicalization of mask compliance. Additionally, there needs to be transparency from governments about their practices to promote compliance. And this leads to people trusting the government more and being more willing to be a part of the process to contain the pandemic. And Australia is a strong example of this because they're unique in that they're one of the only countries to pass privacy legislation specifically related to contact tracing. This legislation and then the legislation I discussed in the UK are different because in the UK, their legislation was primarily just based on giving them broad powers to address the pandemic, while this Australian legislation was directly focused at privacy, which garnered a lot of more support from the people. And the Australian government sought feedback from various privacy and cybersecurity organizations before launching the Australian Department of Health COVID-19 Safe digital contact tracing app. And now let's zoom back out a little bit. Internationally, responses must be enacted as quick as possible if we're to contain, hopefully, God forbid, another pandemic. Shutting down the borders of countries during the initial outbreak of the pandemic could have saved countless lives. And as we look forward into the next few months and most likely the next few years, many countries and international organizations are developing vaccine passports to ensure that harmful variants of the virus don't spread across borders. The international team believes this is a crucial step to marking the end of the pandemic and returning to some sort of normal life. Now, as we prepare for, again, the next pandemic, the main difference must be that global leadership must unite and act early, contact trace, encourage individual isolation and quarantine, and take the pandemic seriously. All of these measures would save lives. And we think these practices would be common sense, but the world, and specifically the United States, could not have been less prepared for the pandemic. We must encourage growth in the realm of global health to better the lives of citizens, both domestically and abroad. Thank you.
Luke, thank you very much. And that call for global leadership, I think, puts a fine point on the opportunity that the OECD is trying to take advantage of by looking at the research that the team has done and trying to draw different conclusions based on efficiency versus privacy, and then what technology optimizes for both to provide recommendations out to member countries. So it's fantastic to see that your team's research specifically was really being rolled up into this international policy organization that's going to be able to provide that kind of leadership. I want to ask all of the attendees, we've got 2 more sub-teams to report out, but also we're going to use the Q&A tool in Zoom. So if you have questions, please start entering them into the Q&A tool. I'll read through them there, and then I can ask the students your questions. So Luke talked a bit about the analysis of the variety of different technologies that have been used in these various different countries that the international team was taking a look at. We also had a tech sub-team that was looking at those individual technologies and looking at what other technologies might be able to be used that would engender trust while also still getting the efficacy from the contact tracing applications. Anna, could you give us a report out on what your team has done?
Yes, hello everyone. Thank you for being here today. I'm Anna DeCesar, a sophomore at Duke studying political science and neuroscience. And for this Fast Connections project, I was part of the technology team. The technology behind contact tracing is integral to safeguarding the privacy of the individual. This semester, the tech team is focused on differences in software that can serve to emphasize the privacy of the individual by ensuring ethical data protection. At its most basic, digital contact tracing uses devices that people keep on them to remember who else they've come into contact with by using Bluetooth to track based on proximity to others. In order for other people to be notified that they've come into contact with someone who is tested positive, it's necessary for some level of information to be shared between users. This could be done by publicly hosting all of the tracking informations of the users for anyone to peruse. But this is an obvious violation of privacy, given the sensitive nature of both health and location data. As a result, the centralized and decentralized approaches to contact tracing have been developed, and both aim to maintain the privacy of users while also fulfilling the functions necessary to contact trace. The official contact tracing apps of countries like Singapore, Australia, and France use the centralized approach, while apps for countries like Switzerland, Canada, and Ireland use the decentralized approach. Contact tracing apps generally follow the centralized or decentralized approach, and each handle user information differently across individual phones and the central server. The centralized approach trusts a central server with user information in order to keep track of infected individuals and notify those who have come into contact with them. In contrast, the decentralized approach trusts the phones of the individuals to store user information and notify the user if they have come into contact with an infected individual. This is a discussion of the tech team's understanding of each approach. A user's phone will have a list of temporary IDs to broadcast and fix interval times, as well as maintain a list of temporary IDs that is received from other phones. When a user tests positive for the virus, uploading that information will allow the server and individual phones to alert their contacts that they've come into contact with a COVID-19 positive individual. When a user begins using the app, the centralized server assigns the app a long-term identifier. The server will then provide the app a list of temporary IDs to send out, which the server has the power to map to the long-term identifier of a device. An app will store the temporary IDs to send out, as well as the temporary IDs of the apps that it's seen. Once an idea has been sent out for the last time, the app will erase it from the list of temporary IDs. If a person is infected with COVID-19 and decides to upload that information, then the temporary IDs of all of the contacts within a certain time frame will be shared to the server. The server in this case would have a list of temporary IDs seen by infected users, which can then be mapped to the associated long-term identifiers. By doing this, the server can alert those users who have come into contact with someone who have been identified as testing positive. The centralized and decentralized approaches have very similar implementations, except the server in the decentralized approach knows the temporary IDs of infected individuals instead of the temporary IDs that an infected individual has come into contact with. As a result, the server is unable to notify those that came into contact with infected individuals and must rely on their phones instead. When a user begins using an app of this kind, the app will store these long-term identifiers and generate and send out lists of temporary IDs. Measures such as these are implemented to ensure user privacy. The list of temporary IDs is stored, and the entities are deleted from it after a sufficient length of time based on how long COVID-19 can be infectious for. If a person is infected and decides to upload the information, either the long-term identifier or the temporary IDs the app has sent out within a certain time frame will be shared to the server. The Google Apple framework does the latter. The server will then store and publish all of the identifiers sent out by the infected users. Individual apps will then check the list of temporary IDs they've seen against the server's list, and then alert the user if there is a match. There are advantages and disadvantages for both of these approaches, but hopefully by implementing technologies that incorporate privacy by design from the start, the trust we have in these technologies can increase. Thank you.
Anna, thank you. And thank you for all the work that you have been doing with Professors Nayak and Tantum to take a look at these different technical approaches. We're incredibly fortunate to have in Professor Nayak, one of the world's leading scholars in how to develop these privacy enhancing technologies. I think there's several great ideas that we're going to be able to potentially recommend out to scale up to be able to optimize both for efficacy and for privacy. As we do that, the measuring that privacy, it's going to be critical to measure not just in aggregate how people feel about whether their privacy is being protected, but also to measure individual groups that may be specifically more at risk and may have more reservations about participating in contact tracing efforts. For that reason, we have a specific trust team headed by Professor Dellinger, who the university is incredibly fortunate to have, as she's a world-class scholar in the impacts of privacy, both for the law and the ethics of privacy. And her team has been doing incredible work. And I think we have Nima to report out from that team.
Hi, everyone, and thank you again for being here today. My name is Nima Aga, and I'm a second year here at the law school at Duke, and I'll be representing our trust team and what we've been working on so far. So when our team came together in the fall semester, we recognized that throughout the project all of us are working on, this idea of trust underlies a lot of the compliance with contact tracing, its efficacy, and of course, a way to implement it ethically. As Professor Halpin recognized, certain groups have both historically and are currently been marginalized in the United States, specifically with the experiences they've had with governmental entities and just the management of public health. Our team has specifically designed and is administering a survey that documents attitudes respondents have with a specific focus on racial diversity. And we've focused our survey on white, Black, and Latinx respondents, and we're hoping to find out the different attitudes members of these groups have on contact tracing, whether that be digital or manual, and if there's any stated preference for those things, trust in different entities that develop contact tracing or exposure notification applications. So this can be large tech firms like Google and Apple, third-party developers, or even state entities that are developing apps. And finally, entities that provide information about COVID-19 and contact tracing. You know, does your racial identity have any effect on whether you're more willing to trust your doctor or a state official or the federal government when it comes to complying with contact tracing and other COVID-19 related factors? We've administered this survey so far, and we're aiming to receive 1,200 responses, roughly 400 from each demographic that we're testing. And we're excited to say that as of early this week, we have received a little over 900 responses. So we're almost finished with data collection, and I would like to share a preliminary finding that we have today. And before I do so, I'd like to qualify that of course, we have not analyzed the data fully yet. We are still waiting to receive a full number of responses. And even upon completing our analysis and having the full 1,200 responses, our findings may be limited, and we'll explore how limited they are. That being said, one of the questions that we had an interesting finding from was this specific question, which was, if you were to test positive for COVID-19, would you feel more comfortable communicating with, and then the options someone can select are a human contact tracer or manual contact tracing, a contact tracing application, or an exposure notification system. And the final response was any of the above is fine with me. From comparing the demographics that have responded so far, we see that white respondents seem to favor human contact tracing. Black respondents are more equal in the preference of responses, with a very slight preference for digital applications or exposure notification systems, and Latinx respondents seem to prefer digital applications. Now, the differences in these responses varied anywhere in popularity from 2 to 10%. So that, and of course, the fact that our study is not fully completed, goes to say that, we can't rely on this information to make any decisions quite yet. But we think that once we can analyze the other questions we have related to entities and trust and willingness to share information and attitudes regarding privacy and how privacy is managed by these groups, that we'll have a pretty good idea of if or how these things vary based on a respondent's racial identity. And we really hope we can use that to narrow in our efforts and use the most efficient and ethical ways of protecting and managing people's public health, recognizing that based on historical and current mistreatments, there's no one size fits all solution, and that we need to approach this in a way that is flexible yet effective.
Nima, thank you so much. I would like to start with a question that was submitted by a member of the audience, and I'm going to open this up first to Emily, but then I would love for all the other panelists to express your opinions on it. And so, Emily, the work that Professor Schanzer and you and the rest of the team have been doing focused on Duke, the question specifically is, if we look at how well the fall went at Duke with contact tracing and the small number of infections, and then the ability to quickly take care of a problem that came up this spring and to bring the infection rate way back down and to keep students still on campus. The question is, what do you think should be learned from that has the possibility of scaling up to cities and counties in North Carolina and then potentially across the country of the United States? Or, and this is for other members of the panel, is it so different to be in a situation like Duke that there's not a lot to be learned? Emily, you first.
Yeah, I think it's definitely an important question because, Duke was really was doing an exemplary job last semester with the amount of cases that we had. And I think a lot of the success from last semester came from the fact that, number one, Duke is a smaller private school. And I think that it is different from a larger state school or even a city or a county because it is smaller. So when there is a positive case, we have enough staff on hand to deal with them individually. And we had the Duke Compact, which I think was enforcing the rules that kept people safe. And I think a lot of Duke's success came from that and came from the contact tracing that we had. And when it comes to things that we can take when it comes to scaling up this sort of effort, I think it's difficult because also since Duke is a private school, there are certain agreements that the students are required to, if you want to attend the university, you have to agree to the Duke Compact. And when it comes to something like a city or a county, it's much harder to get 100% compliance with something like a community-wide agreement. And I can open it up to other panelists, but I think that that's one big difficulty of trying to scale up what Duke did to a larger level.
Thank you, Emily. Luke, do you have comments you want to make on that?
Yeah, absolutely. So that's a great question. And I'm thinking about it kind of in regards to our rubric that weighed efficacy and privacy. And surprisingly, we haven't put Duke on that kind of scale. But based on kind of what I know, I would say that Duke would score, it's very efficacious what Duke has been doing to contain the pandemic. But I'd say it's probably more privacy invasive than any other country. Just as far as they literally track our Wi-Fi, they track pretty much where we are, where we swipe into. So it's just interesting to kind of weigh those different interests and try to find a way that hopefully someday we can devolve a system to prioritize both. But it's definitely not that simple. And it would be very hard to make what Duke is working work at any level higher than Duke, at least from our research and kind of what I think based on what we've learned.
Yeah, and Luke, what I think we've heard, at least anecdotally, it has been, look, Duke collects a lot of this information anyway and makes privacy commitments to students that even absent the pandemic, things like access to Wi-Fi networks or the use of badge readers on doors, that students are already in a situation with Duke that you're relying upon the privacy commitments that Duke might make. And it asks this real question then, is that a similar situation of having to rely upon other government organizations to have access to similar types of data? And are people going to be comfortable with that? And so I'm wondering, particularly if Annabelle or Nima have an opinion on that based on the preliminary results of the research that you guys have been doing.
Yeah, so I would definitely agree with Luke's comment about it being very difficult, if not like unfeasible, to expand Duke's data collection efforts beyond the Duke level. I think especially because just in terms of timing and how this has unfolded, what we've noticed is that even between different rounds of data collection in our work, the counties that have contact tracing references and privacy information references, that has changed in the months that we've been doing the work. So that's not so much the case with Duke because it already had this, this system there. And I think that's been something that's been very noticeable on our end, just to add to Luke's point.
Yeah, and to build upon what Annabelle's been saying, I think our research points to this being a difficult thing to implement in a larger and more diverse population. And I think one thing that is interesting about Duke is that, we have a wide variety of people here from a variety of different backgrounds, yet, we're all here as part of the Duke community. There's a certain level of privilege, so to speak, that we have from being here and in ways that we're treated by the institution, in ways that we're taken care of by this institution. And that, I think, creates a set of trust. I don't imagine that students generally feel like the university's out to get them or will penalize them too harshly, but actually has their best interests in mind. And that's something that I imagine most people would like to feel in order to encourage compliance with contact tracing or really any public health initiative that requires them to bargain their personal information or make themselves vulnerable in the disclosure of the information, especially when it comes to groups of people that either don't have a good reason to trust the entities doing this, or in fact have negative associations that reasonably allow them not to want to interact with these entities. So that's something that we definitely need to consider.
Thanks, Nima. We have a couple more questions that have been entered, and they're really good ones. I think I'd be interested to hear what the students will say. The first is, in countries where contact tracing slash symptom monitoring apps were more widely used slash successful, do you also notice greater COVID-19 education efforts and destigmatizing practices? Furthermore, in such countries, what did healthcare and disability services look like? And I'd love it if you could answer those questions. I think you guys have touched on some aspects of this question, particularly, Emily, you talked about the Duke Compact and how important it was to get out and to describe what the values of the institution were going to be, how important it was to the university to follow the rules that were included in that compact and to educate people on exactly what needed to be done. And I think what we've seen in other areas is less uniform education and communication of particularly the objectives and mapping the requirements of what people are being asked to do to what those objectives are. So let me open up that to the panel and see what your thoughts are.
Yeah,
Luke,
I think.
I'm sorry, go ahead.
Specifically
No,
with the Duke Compact, there definitely was a level of education when it came to mask wearing and physical distancing, which are, of course, vital to helping to control the spread of COVID. I think there were many emails that were sent out and to the Duke community to try to ensure that students understood the severity and the importance of individual contributions. So, and I think that was definitely something that contributed to Duke's success in the fall was the communications that Duke had with the students and their emphasis on individual contributions to the safety of the community as a whole.
Luke, did you see countries in your international work that did a really good job of communicating with the population?
Absolutely. So I think the two that come to mind specifically are South Korea and Australia. Both of these countries have very collective cultures in the way they approach issues and the way they kind of tackle social problems, whereas the United States has a very individualistic culture in the way we approach lots of issues. And so kind of based on their response and the way they kind of came together to address the pandemic. And now you're seeing these Australia especially is kind of reopened just because of their devotion to working together to ending the pandemic. So education and uniformity, and this, it starts at a government level and leadership, are super important for containing the pandemic and contact tracing effectively.
Other comments from Members of the panel? All right, let's get to the next question. Has there been any consideration of willingness to participate in contact tracing based on risk for mortality and morbidity in different groups? For example, are elderly people or immune compromised populations more willing to sacrifice the privacy concerns for the potential mitigation of COVID spread? And I know we didn't specifically separate out that community, I don't believe, to measure trust, but I'm wondering, particularly in the narratives project that you guys have been doing, where you've been talking to different people about their opinions, whether you have perspective from that on how to answer that question.
Yeah, so additionally, the international team has been interviewing people from various countries to hear about their contact tracing, whether it be in their university or their country, to kind of add some stories to this really crazy time. And to be completely honest with you, I don't think that's really a question we've been asking. As we're kind of in the middle of this interview process, that's something I definitely want to start asking in the future, though. So I'm not sure I can give a definite answer on that.
Other thoughts from members of the panel based on what you've been finding?
Yeah, as we've touched on, we haven't looked at that group in particular, but I think with these digital contact tracing efforts, especially, and just in general, as we're in a digital age, that digital literacy is going to be increasingly important for older individuals, but also younger individuals, and just how data is involved in our everyday life. I know in just some of the research that we've done on tech, some people were apprehensive to use apps just because they weren't quite sure how they worked, what data they were actually collecting. They weren't going to read through an entire privacy policy. So as we go forward, I think that education really needs to be catered to people who don't have the level of knowledge that a tech expert does.
That's a great point. I think as we rely more on tech, recognizing that there's a bunch of different factors that would cause people to be comfortable or not comfortable with the technology, and there may be differences in the way folks approach their idea of trust based on that. It's something I think we can take a look at. There's a really, I'm really fascinated by a question that just came up into the chat, which is highlighting the fact that in several countries and here in the United States to some degree, it hasn't just been government efforts looking at contact tracing, but it's been a mix of government efforts and private sector entities developing their own contact tracing approaches. And so I'm just wondering, read the question specifically. It says, in the UK, the test and trace program was run by a private company, Serco, not the NHS. Have you investigated how much profit motive undermines trust? And so if you could expand a little bit, instead of just talking about profit motive, but talk about the relationship between relying on private sector entities and private sector technology companies to do contact tracing versus having government organizations do it completely alone, and whether you think that that impacts both trust and effectiveness. Thoughts?
Yeah, that's a great question. So on the test and trace example in the UK specifically, I know that they had an initial contact tracing effort that was scrapped in mid-June. That was based on a more centralized model of taking in information and storage. And this was initially, I believe, I mean, I could be wrong, but I think run by the government. But in the latest adaptation of the UK's contact tracing, they're starting to use they use the Apple and Google API, which has been super important for keeping user data privacy safe, keeping user data safe and ensuring contact tracing is effective. So I think that Apple and Google specifically have been very helpful for containing the pandemic and a lot of different contact tracing apps. And it's really those kind of the unions between private and public sector that have enabled successful contact tracing in different countries. I could be wrong on this, but I don't believe there's any examples where a private company has a largely used app. I think it's usually combinations of the two.
So I want to expand on that conversation a bit, because to something that we've talked about at several of the research meetings, that it's not just about, I mean, the question was aimed at private sector apps, but obviously private sector partners might play a variety of different roles, including technical roles. I know that the tech team was also taking a look and having conversations about what about cloud service providers having access to the data. You could have a variety of information intermediaries that government participants, or it could be at a county level, or it could be at a country level. They could be relying upon this private sector entity to store the data or to process the data, provide analytics, all sorts of different options. Anybody want to comment on the degree to which that adds complexity and potentially interesting issues around trust?
Yeah, I can speak to some of the trust elements here. Our survey is actually, we haven't analyzed this data quite yet, but we are asking folks and testing to see if there's a difference between willingness to trust something, if it's coming from Apple or Google or a government or a different third-party entity or something like that. And one thing that we found interesting is that we don't have quite the data on this yet, but brand affiliation can be important, of course. If you don't trust the government as much, but you tend to think that Google or Apple have a good reputation, or you're familiar with those products and they're involved together in a way, that can affect the way you perceive the entire effort of the project, or of course it can also taint your perception of those things. So I think the data we have so far unanalyzed shows that it's a little mixed in the air. It doesn't cut across clear lines as heavily as we expected it to, but we're waiting to see how everything falls out before making a final judgment there.
Yeah, and I think on the tech side of it, having intermediaries definitely adds a lot of complexity to privacy of the individual. I know that one example that we talk about a lot is with Duke, a private institution. All of their tech services are in-house. So that data isn't being shared with anyone. From our understanding, there's only 3 people that actually know the sensitive information regarding contact tracing at Duke. But say in meat packaging plants or other factories of the sort where there were outbreaks, and if they wanted to implement a contact tracing service, that would have to be outsourced to another company. And the more levels you have of that, the more that data is being seen and potentially used by other people. So while it's sometimes necessary, it definitely can make the situation a little more complex.
Yeah, I'd also add that I think that what we have found is that when you start going down to a county level and asking questions about whether an individual county actually has the capacity to be able to understand the quality of the data and to be able to respond and to manage doing the audits of private sector entities that might be managing the data, the smaller you get to the universe of the individual government entity, the more it's going to be difficult for them to have the resources to be able to do that effectively, which is one of the things that we've been looking at with small municipality strategies versus a university strategy versus having a country strategy for being able to respond to this. We've got I do want to get to a couple more questions. I think these we'll do a little bit quicker. First is a question around vaccination. And has anybody seen any approaches here that actually allow the contact tracing data to be merged with vaccination status data? I know we've talked about that a little bit, but to my knowledge, I don't think we have found any approaches that do that yet. Luke, do you know of any countries that have done that yet that we've analyzed?
Yeah, so not off the top of my head. The closest example I can think of is, I know, again, in the UK, the contact tracing app can tell you that you need to come in for a test. But beyond that, I don't know how it ties into the vaccine rollout.
Right, if we're thinking about that there's various data streams here or data elements, one being contact tracing and was someone in contact with somebody else, but then you'd have testing, isolation, quarantine, and now vaccination. I think we've seen countries like South Korea and Singapore and China that have integrated the everything except vaccination. I would expect that they would integrate vaccination, but it's a really good question. I don't think we've seen anything that has reported yet that they have done that yet. Anybody have anything else to add there? All right, next quick question. How are these apps ensuring that the data they collect is of a certain quality?
Yeah, absolutely. So again, an example is Australia, where they hired in outside cybersecurity and privacy experts as kind of their like watchdogs to ensure that they're handling data in the correct way to ensure people's privacy is protected. I think a lot of countries are doing a pretty good job about this for the most part.
Okay, I think that's right. And I think that has been a focus of the countries that have more comprehensive programs. Other responses from folks? All right, let me go to the last question then. And it's primarily for the international team. That's one of the tensions as countries made decisions about how to respond to COVID was between public health and economic impact. Do you know of any examples of a country or countries that did both fairly well? And do you have any thoughts about whether contact tracing had any negative impact on the economy or of any economies?
So I would, again, I think a lot of countries took one extreme or the other. Like example, in the United States, we prioritized opening businesses over public health, which had its consequences. A lot of countries in the EU prioritized opening schools over opening businesses, which had its consequences. And so all these different countries kind of have their priorities and different things that they've been emphasizing as they've reopened. But I don't know if there's a single country that prioritized public health and economic impacts and all of those things collectively together and had the best option. I mean, with a lot of these things, kind of similar to weighing efficacy and privacy, a lot of it's give or take, and you can't always have everything, unfortunately.
Other comments from folks on the panel? All right, well, it appears that we're out of time. I want to thank the folks from Basque Connections, and I want to thank the folks from Science and Society. Specifically, I want to thank Sarah Risman-Sedlak for helping to arrange this and allow this. And I want to thank the students for all of their hard work and being willing to dig in an interdisciplinary way. I think you've all seen that the range goes from folks from engineering school to the computer science department to public policy, graduate students in law and other disciplines, and folks from arts and sciences. It's been a real pleasure to be able to work with the students. We're still getting the results back, and the team is putting the link to our website in the chat. Anybody who's interested in learning in more detail, specifically, we've been taking a lot of our results and doing blogs that are on the website. You can look there, or you can contact me or other members of the faculty, and we can try to answer other questions. Thank you all for attending.